Bismillahirrahmanirrahim. I'm Dr. Abdul Rahman and we are learning ECG. I hope you remember when I defined ECG as the graphical representation of electrical activity of the heart. So in this video, we will focus on this electrical activity and we will discuss that how this electrical activity is converted to a graphical representation in the form of an ECG. So let's take you to my whiteboard. This is a picture I took from Google. I think this is the best representation of the electrical activity of heart. We know that we have different types of tissues in the heart. Some of them are called conducting tissues, which include SA node, AV node, and Purkinje fibers. So these three are the conducting tissues of the heart. And some of them are the contractile tissues, which are the atrium and ventricle. So we have total 5 different types of tissues. 3 of them are conducting, and these 3 labeled in red, they are also called pacemaker cells because they have potential for pacemaking, and they are all because they have a potential of automaticity. SA node, AV node, and Purkinje fibers. And rest of the 2 tissues which are in the atrium and in the ventricle, they are the contractile tissues because their main function is the contracting and pumping blood to the next chamber. Broadly speaking, yes, we can say that they don't have pacemaking potential, but it is not always. So for this, as for now, we will just establish this fact that these tissues don't have pacemaking potential under normal condition, but at the back of the mind, just keep it in mind, there are some conditions when atria and ventricle can also generate impulses on their own, that we will discuss later on in some video. Okay, so let's have the next picture. This is the same one. So we have established up till now that we have SA node, AV node, and Purkinje fibers, which are having pacemaker potential, which have the potential of automaticity, and which are the conducting tissues of the heart, while atrium and ventricle are the contracting tissue of the heart, which usually don't have pacemaker potential and don't have automaticity. So I will explain what is the pacemaker potential and what is the automaticity later on. But as for now, the reason our main focus in this video is to look how this ECG is generated. So our impulse starts from SA node, we know that, and this is the action potential of the SA node. So SA node had this type of action potential. Impulse is generated in SA node. It travels to both of the atria and depolarizes atrium. And this atrial depolarization, which is shown in this graph, it is represented as a P wave in the ECG. So when you look at the P wave, you should think about atria, you should think about atrial depolarization, and any change in the atrium will lead to the change in P wave. Any enlargement in the atrium, any irregularity, any extra focus of origin of some impulse in the atrium will lead to change in our P wave. So P wave represents atrial depolarization. Then impulse travels from atria and it converges to our AV node. And in AV node, we know that AV node is having some delay in the impulse, and this delay helps atria to contract before ventricle, so that blood should pump in the same direction from atria to ventricle and not vice versa. So impulse reaches AV node. This is AV nodal action potential, and there is an AV nodal delay, and that delay in the AV node is represented by PR interval. So whenever there is a increased delay in AV node, our PR interval will increase. And if in any condition this interval decreases, our PR interval decreases. Simple. So this PR interval shows conduction through AV node and especially AV nodal delay. Then impulse reaches Purkinje fibers. And there is depolarization of the Purkinje fibers. And these Purkinje fibers include bundle of His, right and left bundle branches, and goes to all the cells, all the cardiomyocytes, all the cells in the ventricle. And this depolarization of Purkinje fibers will lead to depolarization of the ventricle, of both ventricles. And these both ventricles are depolarized at the same time. So right bundle and left bundle both make ventricle, both right and left ventricle, to depolarize at the same time. If there is any delay in either bundle, then there will be a problem. There will be a problem in this QRS, because this QRS complex represents ventricular depolarization. So impulse starts from SA node, atrial depolarization. It stays in AV node for some time, AV nodal delay, PR interval. It goes to Purkinje fiber, which helps depolarizing ventricle, QRS complex. And then after depolarizing ventricle, there is there is a plateau phase in our action potential, and this plateau phase is due to calcium influx and potassium outflux. And this plateau phase is represented as ST segment in our ECG. Or broadly speaking, we can say that it is QT interval. So if there is any problem in the calcium influx, it will affect the QT interval, which we'll discuss later on. And then it will be followed by a repolarization, and this repolarization will be represented in the form of a T wave in our ECG. This is ventricular repolarization. And ventricular repolarization will be showed as a T wave. And after that, there is a flat line which will be our baseline, and sometime we can have another wave that is called U wave, which will show Purkinje fiber repolarization, because Purkinje fiber have a longer action potential and they repolarizes even after the ventricles. So we can have a U wave after that. So this is how ECG is generated. And let's have the same picture again, because that first one is all gone. So now we know that atrial depolarization with P wave, AV nodal delay, PR interval, ventricular depolarization, QRS complex, ventricular repolarization, T wave, plateau, QT interval or ST segment, and U wave will be from Purkinje fiber repolarization. Now you can ask a question that if we see ventricular repolarization in the form of T wave, where is atrial repolarization? If you have a look, atrial repolarization falls directly under QRS complex. So because QRS complex is so huge, atrial repolarization is buried inside it, we can't see it. Similarly, the SA node and AV node impulses, the voltage generated by SA node and AV node action potentials is difficult to see, because SA node maximum it can go to +1 as compared to QRS complex or atrial depolarization, which can go up to 30 or sometimes 50 millivolts as well. So SA node depolarization might be at this point, but it cannot be represented in ECG. So ECG will show. So now we can say that what is ECG? ECG is actually a cumulative effect of all the depolarization which is happening in the heart, from SA node to atrium to AV node to Purkinje to ventricles. All the depolarization and then all the repolarization which is happening in the heart, it is being shown by the ECG. So we can establish another fact here, that if we want to learn ECG, we need to know about these graphs, and we need to know about these graphs in detail. So in next videos, I will take each one of these graphs and I will explain how the graph is formed and how different ions, which include three most important ions, sodium, potassium and calcium, will affect each of these graphs, and ultimately this will lead to affect our ECG. So this is it for this video. See you in next one.